Let's talk about something that's on the minds of so many new parents: getting back to physical intimacy after having a baby. It's one of the most personal and honestly confusing parts of the whole postpartum journey. It is just surrounded by questions, but in this explainer, we're going to give you some clear, expert-backed answers to help you navigate it all with confidence.
Okay, let's just jump right in with the big one, right? When can I have sex again? This is, without a doubt, one of the top questions new parents have. But the answer, well, it's not so simple. It's this whole mix of physical healing, your emotional readiness, and, let's be real, a massive dose of new parent exhaustion.
And, this question, it can carry so much weight. If you're feeling anxious or maybe a little pressured or just completely and totally unsure about it all, please know that is 100% normal. It's valid. So our goal here is to cut through all the myths and give you a really clear framework to think about this. So, here's our game plan. We're going to start by tackling that famous 6-week question. Then, I'll introduce you to the amazing expert behind this guide, Dr. Farzana Khan. We'll break down how your body heals based on different birth experiences, give you a super practical readiness checklist, and finally, talk about how to navigate this brand new normal.
All right, first up, the 6-week rule. I'm sure you've heard it. It's probably the most common piece of advice out there. But as we're about to see, a one-size-fits-all timeline, it just doesn't work here.
And this is so important to get. That 6-week postpartum checkup, it's a huge milestone, for sure. It's for your doctor to see how you're healing, but it is not some magical green light for sex that applies to everyone. The right time is when you feel physically comfortable, emotionally ready, and when your postpartum bleeding has stopped. For some people, that's before 6 weeks. For a lot of others, it's much later.
So where is all this great information coming from? Well, the foundation for this whole explainer comes from Dr. Farzana Khan. She is a specialist in women's health, and her expertise is going to be our guide for the rest of this conversation.
I mean, just take a look at her career. Dr. Khan has more than 20 years of experience, literally from the front lines in obstetrics and gynecology, all the way to becoming a leading specialist in sexual and reproductive health. She really knows her stuff.
It's this deep well of expertise that gives us such a clear, trustworthy approach to a topic that can feel really confusing. So with her as our guide, let's dive into how the body actually heals.
And this brings us to a huge point. Your recovery is totally unique to you. Your birth experience and any injuries you might have had directly shape your personal healing timeline. It is not one size fits all.
Okay, this chart is fantastic because it shows the massive difference between what's happening on the surface versus deep down. A small first-degree tear might feel better in a couple of weeks, but now look at a C-section. The outside scar might heal in 6 to 8 weeks, but the deep internal layers, that can take 3 to 6 months to fully repair. See why a single timeline just doesn't make sense? And listen, it's not just about the physical wound. Hormones play a massive role here. If you're breastfeeding, your estrogen levels are low. This can cause things like vaginal dryness and thinner tissue. It's actually pretty similar to what happens during menopause. This is so critical because you could be totally healed from a tear but still feel discomfort because of these hormonal shifts. So with all of this information swirling around, how do you know when you are actually ready? Well, this next section is all about getting practical. We've got an actionable checklist to help you figure it out with confidence.
Think of this as your own personal green light system. So, step 1. Has that postpartum bleeding, which is called lochia, completely stopped? Step 2. Do any wounds or stitches feel closed up? A really good test here is step 3. Can you insert a finger or even a tampon without feeling any sharp pain? And finally, can you consciously relax your pelvic floor muscles, or do they feel tight and clenched? If you're nodding yes to all of these, your body's giving you some really positive signals.
Now, we also need to bust a really common myth. A lot of people assume that if you had a C-section, getting back to sex will be easier because there was no tearing. But as we've just talked about, those hormonal changes affect everyone. And the deep internal healing from major abdominal surgery, that is a huge factor in your overall comfort and readiness.
So, what can you actually do to make the experience better? Let's open up the toolkit. First, and this is a big one, lubrication is absolutely essential. It is not optional. Be generous with it. Next, maybe start with non-penetrative intimacy. It's a great way to rebuild that connection. Talk to your partner. Be open about what feels good and what doesn't. And try in positions where you're in control, like you on top, combined with some deep breathing to relax your pelvic floor. That can make all the difference.
And if you take away only one thing from this entire explainer, please let it be this. Pain is not something you just have to put up with. It is a clear, loud signal from your body that it's not ready. Pushing through it can actually create a really negative cycle of fear and muscle tensing that just makes everything worse. So please listen to your body.
But what if you've been patient? You've tried everything in the toolkit and things still just don't feel right. Okay, now it's time to talk about when to seek help and the amazing options that are out there for you.
You are not alone in this, and there is so much support available. A pelvic health physiotherapist is incredible for working on scar tissue and getting those muscles working right. Topical estrogen can help with that hormonal dryness, and counseling can be a game changer for the emotional side of things. For issues that just won't go away, specialist clinics even offer advanced treatments like PRP or laser therapy to help promote that deep healing.
So, what's the timeline here? When should you make that call? Well, the general guideline is this. If you are still having persistent pain with intercourse 3 to 6 months after giving birth, it's time to see a specialist. Don't just wait around hoping it will magically go away.
And finally, let's be super clear about a few things that are definite red flags. These require immediate medical attention. We're talking about any signs of infection, like a wound that reopens or has a bad smell, or severe pain that's getting worse, not better, a fever, chills, or any issues with controlling your bowels. These are not things to wait on. Please, call a doctor right away if you experience any of these.
To close out, I just want to leave you with this thought. This journey back to intimacy, it's not really just about getting back to the way things were before. Your body is different. Your life is different. So what if we reframe this? What if it's less about recovery and more about an opportunity for rediscovery? A chance to find out what intimacy means for you and your partner in this new chapter of your lives.